this is what they've been doing lately. They've shifted. I think people are on to the whole cases, understanding that's not a meaningful number. You know, it's a pandemic, it's a virus. People are going to get the cases of COVID. It's how bad is it, and what are the hospitalizations, and what is the death rate? And this is something they've been using to scare us. The hospitalizations are up here, there, everywhere. And now we learned that it's that they're overstating the numbers of people who are in hospitals right now because of COVID, and overstating how sick they are. Put it in perspective for us.
Yeah, so actually, this is a result that goes back a ways. There was an audit in Santa Clara County and in Alameda County of death certificates, for instance, and found that in 25% of cases that were coded as COVID deaths, actually 25% of the time there were other factors that were probably more important in those deaths than COVID. COVID in hospitals have had a very strong incentive to diagnose COVID. Going back to the CARES Act last year, some hospitals got more than $50,000 additional per COVID patient that they had. And so so there's a mix of things going on here. But I think there's a really important public health point here, which is that these cases have been used to scare the public into thinking that we're running out of hospital resources or healthcare resources, scare the public into thinking that COVID is more dangerous than it is. It is dangerous, especially for an older, vulnerable population, as we've talked about many times. But it's not 3% mortality like we heard in the early days of the epidemic. It's much closer to 0.2% infection fatality rate, unless you're older, in which case it's much higher. So I think that's really the upshot of this study for me, is that we as the media, I think, has an obligation to put the COVID numbers in perspective rather than using it to stoke fear. And this study suggests that that's exactly a careful analysis of the data, which is what this study is trying to do, to say, okay, distinguish between you have COVID and died from COVID versus it's incidental, is really important to start to put those numbers in perspective. And I hope the media sort of responsibly takes this and helps people allay some of the fears they may have about COVID.
You're so cute. You know they're not going to do that. But hope springs eternal. But I got this originally from, again, David Zweig, who had been on the other day. And it says that the study suggests almost half of those hospitalized, almost half with COVID-19, have mild or asymptomatic cases. That what we're seeing is these folks in hospital with fairly mild symptoms. They've been admitted either for further observation on account of their comorbidities or because they reported feeling short of breath. But a lot of them are in the hospital for something totally unrelated to COVID. So you go in for a broken leg, they test everybody who goes in, they find out you have COVID, and they count in the hospitalization number that is used by the media to scare us all. And I ask you, I didn't realize that they were getting paid. The hospitals have a financial incentive to do this.
Yeah, that was from the earliest. The CARES Act, he had $50,000 per COVID patients. For Medicare patients, they would get 20% bonus. The hospitals would get 20% bonus for seeing COVID patients. So they do have a very strong incentive to diagnose COVID, even if it's incidental.
That's crazy. That's so crazy. Why would we incentivize hospitals to state the number? Or why, at a minimum, why wouldn't that be a big asterisk on every media report when we get these naked hospitalization numbers out?
Yeah, I think in the early days of the pandemic, that's when the CARES Act was passed. The thought was, well, these hospitals they're going bankrupt because people were so scared to go to the hospital for actual things that they needed. Cancer surgeries were canceled. Many hospitals around the country essentially were empty, waiting for COVID patients that never arrived in the early days of the epidemic. And I think partly it was aimed at addressing the financial crisis caused by that sort of panic around COVID. I think that was the initial impetus behind the policy, but I think it has had this unfortunate effect of sort of it's kind of a catastrophe, right? Like you have this well-intentioned policy to keep hospitals afloat, but it results essentially in overdiagnosis and induced panic. And I don't think people had thought through all of the downstream consequences when the policy was put in place.
Well, and two other things to note about the study. Okay, so nearly half of those hospitalized, with COVID may have been admitted for another reason entirely or have had only a mild presentation of the disease. The increase was even bigger for vaccinated hospital patients, of whom 57%. So keep in mind, so when you hear these hospitalization numbers, so 57% of those who have been vaccinated and are in the hospital with COVID had only mild or were asymptomatic entirely. And then how about the unvaccinated? They've been totally demonized by Biden and others. And this study found that 45% of the cases with the unvaccinated were mild or totally asymptomatic since January 21st. So once again, it's not as awful as they lead us to believe. But how do we square that, Doc, with headlines like this one? COVID hospitalizations hit crisis levels in southern ICUs. This is one of the lead stories right now in the New York Times. Hospitals in the southern U.S. are running dangerously low on space in intensive care units. 1 in 4 hospitals now reports more than 95% of the ICU beds occupied, up from 1 in 5 last month. Alabama, Texas, Florida, talking about problems there. So how do we square those two things?
Well, I mean, I think that actually hospitalization numbers, like in Florida, with COVID, are plummeting right now. So I think the HHS actually tracks this. You can go to a website called HHS Protect and see what fraction of beds are occupied by COVID patients. And the headlines often don't square with what HHS is reporting. I'm not sure why the media aren't using those like official numbers to track it. I think there's another sort of a problem in how people think about this. Hospitals are not single entities that operate simply by themselves. They're part of systems. So when one hospital gets crowded or one hospital gets stressed, patients get moved to other hospitals. They're part of a system. And the question isn't whether a particular hospital is overcrowded or stressed. The question is whether the system as a whole has capacity to address the health needs of a population. I think there have been times during the epidemic where some hospital systems have been pushed to the brink. But I don't think that as a whole, the American healthcare system has been overwhelmed by COVID patients. I think it's been stressed in some places near the brink. And in that sense, American healthcare system has actually operated better than many other healthcare systems around the world, which have been overwhelmed with patients. I mean, this is a real disease. It for a subset of patients, it actually does result in the need for ICU beds and hospitalization. I do think that there are costs in addition to the monetary costs, there are health costs also from overdiagnosis or over reliance on hospitalizations for asymptomatic COVID patients, because those hospital beds could be better used for other patients.